Hello everyone, my name is Ashish RAhi, Assistant Professor in RPIIT Pharmacy, and today my topic is about GPP standard for instruction to the patient to ensure that the patient know how and when to take the use of the products. And counseling is a professional responsibility of pharmacist. That it is the option for the pharmacist, not an option for the pharmacist. Every pharmacist must develop this skill in order to ensure GPP and rational drug use. It is imperative for the following reason: patient need to be motivated to take their drugs. Patient do not read instruction on labels. Many patients do not read and advice on the drug is better appreciated if the drugs are before the patient. The pharmacist's active involvement in patient counseling will improve patient adherence and the following area that is name of the medication indication in the language that is this medicine is for blood pressure removal of medicine from the pack that is this should be demonstrated dose dosage interval and duration and side effect should be asked from the patient about by the pharmacist what to do when the side effect occurs and the contraindication that is state food drugs or drugs to be avoided and the storage of leftover drugs and this is the GPP standard for records to the record the main function is to facilitate patient and care and provide audit trail. In this the record all the medicine supply should be kept detailing of the name of the patient name and strength of medicines and the record should be maintained in the system manual. All the personnel should be trained and equipped in terms of literature and support material. And after that, the pharmaceutical care and health information for the GPP center is to provide health promotion, literature and support material, provide an area suitable for the delivery of basic information counseling, provide a separate confidential room, and where the pharmacists are involved in giving advice on self-medication and response to symptoms. If there is a standard are followed strictly, then the pharmacist can be ensured that the average is providing service that comply with the patient. Patient need to motivated to take their drugs and patient many patients do not read instruction labels and advice on the drugs. The pharmacist's active role in patient counseling will improve patient adherence to the drugs. So this is the basic requirement for GPP for the patients and the labeling.